Health, Home, and Lifestyle. Presented by Paradise Fitness Center, changing lives since 1996.
Hafide, and welcome back to Health, Home, and Lifestyle. I'm here in studio with Dr. Beth Samara to talk about the upcoming Guam Healthcare Providers Cancer Symposium. So can you tell us a little bit about the upcoming event?
Well, yes, it's going to happen on Sunday at the Hyatt from 7:30 to 1:30 in the afternoon, and it's for health providers. So we have invited physicians and nurses, nurse practitioners, and other health professionals to participate in the symposium. It's entitled, "You Are the Key to Cancer Prevention." It's sponsored by the UOG Cancer Research Center, and we have a number of community partners who are helping us with the conference symposium. We have focused on HPV and cervical cancer prevention because this is a very the incidence of cervical cancer is fairly high in Guam, and addressing health professionals is critical. There's a lot of research and findings in other places that health providers are really critical in terms of trying to persuade patients to get vaccinated, for example, and go in for cancer screening, and so that for our health providers to have the information, the latest in research and the new screening guidelines, and also the importance of HPV vaccination is really critical. So that's why we focus on this for our outreach from the Cancer Research Center.
All right, so this symposium will focus on cervical cancer, and like you mentioned, the reason is because of the incidence in Guam. So can you tell us a little bit about how prevalent this type of cancer is in our community?
Yes, well, what we found with surveys through BRFIS, for example, the Behavioral Risk Factors Survey, also the tracking that's been done by the Cancer Registry over the past few years, is that Micronesian women, for example, are 5 times more likely to have cervical cancer than the U.S. mainland. So there's been an incidence of 39.8 new cases among Micronesian women. So that's 5 times the numbers that we have for the U.S. mainland. And among Chamorro women, the rate is twice the U.S. rate. So that is 14.34 for every 100,000 women. So this is a cancer that is on the top 5 here in terms of incidence and also mortality, and so there's really a need to try to promote cervical cancer screening and HPV vaccination. In the U.S., for example, the screening rates for women are around 82% and here in Guam it's only like 68+%.
Okay, so for all of our viewers out there, considering the high prevalence of cervical cancer in Guam, it's important to check with your physician, get checked, and of course, this is geared for our healthcare providers. So for those who don't really know anything about cervical cancer or HPV vaccinations, how are the two linked together?
Well, the HPV, the human papillomavirus, is almost all cervical cancers are caused by it. So in Guam, for example, there were 104 HPV cases reported in the last 3 years. Also too that the HPV vaccine is available, and there are new guidelines that have been instituted recently, and it used to be that it's a 3-shot vaccine and within a 6-month period. Now if children, and this is both boys and girls, get vaccinated as early as 9 to 11, there's only 2 shots that's required. So there's some new information that our health providers, of course, are in the front line for this, also with screening guidelines. So this is going to be the focus of the symposium. Among our speakers, for example, is Dr. Rachel Consoli, who's a new physician on island with FHP, and she is going to be talking about the current guidelines on cervical cancer screening. Dr. Amanda Del Rosario from American Medical Center is going to be talking about HPV vaccination. So that's in addition to other presentations, a couple of colleagues from the Yogi Cancer Research Center, Dr. Yvette Paulino and Dr. Anna Joy Mendez, and myself are going to be talking about the distribution of cervical cancer and HPV here in Guam. And we're also going to report on a health provider survey and some key informant interviews we conducted last year, and as to get some insights about how our local providers feel about cervical cancer screening and HPV vaccination.
Okay, so like you mentioned, this is geared for healthcare providers, but for people in the public, they should get checked. And if and because the cervical cancer is linked with HPV, that's why these vaccinations are so important. But for those who might be a little bit concerned about vaccinations, do you have any message to them?
Well, the Centers for Disease Control, their slogan is HPV vaccine is cancer prevention. There's all kinds of myths about the dangers of, and so sure there can be some side effects for some people in terms of vaccinations, but for example, there was that study that linked vaccines to autism that's was discredited a few years ago, but it still keeps coming up like, you know, like an old urban legend, and so the risk for that are associated with getting cancer are higher than any possible side effects that you may have. So what's interesting is that, for example, we have a much higher rate for Tdap vaccines for tetanus and diphtheria and pertussis, but the diseases that are a result of, you know, not getting vaccinated for those are much lower than the incidence of diseases that are coming from HPV-related illnesses.
So for people, I know there's a few spots left if they want to register. Where should they go?
Yeah, the online registration was closed as of Friday, but some health providers who might be interested to attend the symposium, we still have a few slots available. They can call the Cancer Research Center at 735-3036, or they can email guam.symposium.cancer@gmail.org.
All right, thank you so much, Dr. Samara. Stay tuned, we'll have more Health, Home, and Lifestyle after the break.